Good afternoon, everyone. Thank you for tuning in to 211 Connecticut's first webinar in our 2019 Fall Webinar Series. Today we're going to focus on tools for professionals, but before we get started, I want to quickly talk about our webinar series and kind of give you a quick housekeeping overview of how we'll structure today's webinar. Once again, this is the first in a series of fall webinars that 211 Connecticut is offering. The next webinar will focus on utility assistance resources in Connecticut, and will be on next Thursday, October 10th at 12:30. If you haven't already signed up, I'll show you quickly how to do so that you can be ready to rock and roll for that webinar as well. This webinar is going to be intentionally brief. It's only going to be about 30 minutes, so I want to give you guys a quick warning that we are going to cover a lot of content. That said, the webinar is being recorded, so it'll be distributed to everyone that's registered for the webinar after, as well as a slide deck that will detail some of the topics and tools that we'll go over today. So thank you again for tuning in, and I'm going to go ahead and get started. Just so that everyone knows, you're in listen-only mode, which means that if you have a question or a comment throughout the webinar, please feel free to use the Q&A or the chat box to type in those questions or comments. At the end of the webinar, unless I catch it during, I'll be sure to go back and address all of your questions. And once again, if it's a question that I can answer offline, I'll follow up individually. So thank you, and let's get started. So 211 Connecticut is a free 24/7 resource for Connecticut residents that helps connect people to the health, education, and information that they need to succeed. So we strive to be the go-to resource for Connecticut residents. And today's webinar is going to focus on how we try to partner more strategically with professionals across the state by offering some tools that are free and publicly available on our 211ct.org website. So for those of you who haven't visited 211ct.org, this is our brand new homepage. You might not recognize it because we recently changed the color and the picture to have a fresh new look. When you arrive at the website, I want to draw your attention first to the very top of the screen where you'll see this yellow banner. Anytime there's a new feature in our website or a new topic that we want to focus on, such as our fall webinar series, we try to make that information as obvious as possible to people that visit our homepage. So right now, as you can see, we're focusing on our fall webinar series. Once again, if you haven't signed up for other webinars, you can click on that banner, click on the link, and right here you can dive into our other webinar offerings throughout the fall. I'm going to go ahead and jump back to the homepage and continue to give you a quick tour of this page. You'll also see at the very top that there's some tabs, and today we're going to spend a lot of time on this professionals page. But before I go there, I want to show you some of the bells and whistles on our homepage. There's three basic ways to search within our website. The first is by program name or agency name or service or keyword that you can type right into this chat box here. If you click on that box, you'll also notice that there's what we call our help statements. So these are suggested search statements that are based off the conversations that our 211 Connecticut call specialists have with individuals that call 211 seeking help. So they say, I need a place to stay tonight, I need help finding housing, I need to find a job. So if you click on any one of those help statements, it will also generate some search results based on what you select. The third way to search is through our categories. So listed here on the homepage are our top categories. If you click on any one of these, it will dive into some deeper subcategories to help you kind of hone in on what information you're really looking for. If we scroll all the way to the bottom of our homepage, you'll see that we call out some of our other specialized services. So 211 Connecticut is a program of United Way of Connecticut. We're one of many 211s that are located across the country, so more than 94% of the country has some type of 211 coverage, and many, like ours in Connecticut, is operated by United Way. We wouldn't be able to provide the service that we do without generous contributions from our 15 local United Ways and from the state of Connecticut. We're considered a blended contact center, which means that in addition to providing traditional information referral services, we also handle crisis intervention calls and suicide calls. So for those of you that are familiar with our service and our core 211 service, you've probably dialed 211 before and spoken with one of our wonderful contact specialists. What you might not be aware of is that in addition to 211, United Way of Connecticut also operates our Child Development Info Line, which connects parents to services for children with suspected diagnosed developmental delays and serves as the intake for our Birth to 3 service. We also have our Child Care Search website, which helps families find child care programs that meet their needs. Just like our 211 website, it's very user-friendly. It allows you to customize your search to find exactly the type of child care that you're looking for your children. We also serve as the central intake for the Youth Mobile Crisis Intervention Service, formerly known as EMPS, which means that if you are working with a youth, if your child, if you work in a school system, if you're in the community, and there's an individual that's 18 or under, or 18 but still enrolled in high school, you can dial 211 to be connected with one of our contact specialists who will help sort of navigate through what that individual might be experiencing and then connect you to a clinician that will be dispatched to help de-escalate the situation and make a care plan going forward. That service, just like our standard 211 service, is available 24/7, 365 days a year, and we'd like to say that we'll have a clinician dispatched to de-escalate that situation within 45 minutes. We also operate 211 Housing, which serves as the central intake for the state's coordinated access network that helps individuals connect to emergency shelter within Connecticut. And in addition, we will see our final tile here is our community events calendar, which makes public a number of events offered throughout the state. We have more than 4,000 agencies that are sponsored within our database, I should say. So our only criteria for being present on this community events calendar, and I'll go ahead and click on it very quickly, is that the different events are being offered or being sponsored by an agency that currently exists in our database, that the events are free and that they're open to the public. So you can see that we try to keep this calendar as populated as possible. If you or another partner organization that you work with has an event coming up, you can click right here, Submit Calendar Item, to go ahead and tell us about that event. And if it meets our criteria, we'll go ahead and we'll add it to our calendar. So now that we've done a quick overview of the homepage, I want to call out a couple of our specialized tools that we hope will be super valuable with you as you're working with your clients. The first is our 211 online benefit screener, Navigator, which some of you may be familiar with. This is a tool that's been around for a long time. It's a tool that helps individuals screen for potential eligibility for 23 state and federal public benefits programs. So here's an overview of those programs. It's our Care for Kids program, Earned Income Tax Credit for individuals that qualify, food stamps, also known as SNAP, and a number of other programs. If you click on one of these, you'll see that it gives you not only a quick description of what that program or public benefit is, but also the ability to click for more information or to click to begin an application. The benefit screener itself is quick, it's non-intimidating, and we like to say that it takes only a few minutes to complete, and it will help give people a pretty good idea of some of the programs or public benefits, state and federal, that they might be eligible for. We don't want to know information about, your social security number, or your first and last name, or your banking information. All we want is kind of a general idea of sort of your details, your family details, your income details, so we can generate a list of potential programs and services that might really help you or the clients that you're serving. So that's our 211 Navigator. Once again, you can access that all the way at the bottom of our homepage. Another quick tool here is our housing voucher program website, which we maintain in-house here as well. So if you are working with an individual that has Section 8 housing or has a voucher, this is a really good website to continuously check or to even sign up to receive current postings. So you can go ahead and you can register to receive emails every time there is a posting. So if you click here, you can add your email or add that client's email so that you're alerted every time there's a new Section 8 posting. We know these are few and far between and sometimes hard to come by, so that's a great way to make sure you're staying in the loop for those resources when they are available. And finally, one of the last tools I want to make you aware of is a new navigator that we're calling our Healthy Lives Navigator that's also available right on the homepage. And this is actually, in my opinion, another great way to kind of navigate through our programs and services. So there's a sort of a growing body of research and awareness around what are known as social determinants of health. So what are the social barriers, or what are the income or financial barriers that prevent people from living their healthiest lives? We know that it's more than clinical issues. We know that individuals have social needs, that if they're able to overcome those social needs, they can live a better life. So this 2-in-1 Healthy Lives Navigator is brand new. And once again, it's a great way to kind of target your search within our 2-in-1 database to better generate a list of resources or programs and services that you can refer your clients to. So let's go ahead and we'll take a quick walk through this this Healthy Lives Navigator together. So the first question is, who are you completing your screening for today? And I'm going to choose my client. I'm going to say yes that my client is comfortable speaking English, but if they weren't, there's this really handy globe right in the upper right-hand corner of our homepage where you can choose between 33 different languages. So if I wanted to enable or empower my client to take this screener on their own, and they spoke French and weren't comfortable navigating through in English, I could select French, and you'll see that all of the questions and all the descriptions are then translated. For right now, we're going to stick with English and keep scrolling through the different options. So I'm going to say, yes, I do speak English, or I'm comfortable speaking English on behalf of my client. For the age, we'll say the individual that I'm working with today is between 17 and 24 years old. Do they lack transportation, or do they have issue getting to doctor's appointments or work? We're going to say no. For right now, there is no transportation barrier, but if the answer was yes, you could certainly select yes. In the past 12 months, have you been worried that any of the following services would be shut off? Once again, I'm working with my client right now, and I'm going to say that they responded, yes, I've been concerned about my water bill. I'm having a difficult time affording my water bill. Finally, what is your current housing situation? We're going to say that for this individual that they have housing, but that they're worried about losing it. You know, they have utility bills that they're struggling to afford month to month, so we'll choose that middle option right here. Within the past 12 months, were you worried that your food would run out before you had money to buy more? We're going to say that's sometimes true. This individual is saying that sometimes they are food insecure. You know, they're able to put food on the table, but sometimes they're not sure if they're going to have enough money to buy more. And once again, within the past 12 months, the food you bought just didn't last, and you didn't have money to get more. I'm answering on behalf of my client again, and I'm going to say that's also sometimes true. Which of the following best describes your current work situation? So the individual that I'm working with today that I'm helping complete this Healthy Lives screener has a job, but they're looking for work with better pay. So I'll select option 3 and continue scrolling through my questions. In the past 12 months, have you experienced any of the following common barriers to employment? I'm going to say the individual that I'm working with right now is having trouble affording childcare. We know that childcare is one of the largest expenses for young families across Connecticut. So if you have an infant or a toddler that's in childcare, that can be a huge expense for a young family. Finally, do you have a high school degree? We're going to say the individual that I'm working with today does have a high school degree. And do you ever worry that you may have a problem with any of the following substances? So the client I'm working with says, yes, they are concerned, but they may be drinking too much and they have an issue with alcohol. At the very bottom, your last question asks you to type in your location. So I'm going to say that my individual is located in Niantic. So they're looking for services, programs and services and resources that will serve an individual that lives in Niantic, Connecticut. If I click submit, we'll see that we have a list of resources. What we call these our taxonomy terms. It's how our database plugs resources and draws them out of the database. So we have a list of taxonomy terms or resources that we think our individual might benefit from being connected to. If I click View Resources Near You, and for those of you that have used our 211ct.org website before and have run searches either via keyword or program name or used our help statements, you'll realize right now that we end up right back in our database to search for programs and services. So based on the answers that we gave to those questions in our Healthy Lives Navigator, there are 244 programs and services that are serving someone living in Niantic that might be battling these social determinants of health. If I click here, I can start to whittle down that list. That's kind of an intimidating list for an individual. So let's say that I only want to look at resources that are located within 5 miles of Niantic, Connecticut. If I go ahead and click Filter, it will pare that list down to just show programs and services that are located within 5 miles. So now we see that it's a much more manageable list. We see that there's food pantries that this individual could access. The town of East Lyme has a temporary financial assistance program that individual could connect to help them better pay for their water bill. So maybe you're working with an individual that doesn't have time to go comb through all these resources right now. And that's why this other tool that I'm going to show you is super important, and it's called a My211 account. I'll show you in a little bit how you guys, if you don't already have one, can create your own My211 account. But what a My211 account allows you to do is to create and save custom resource lists or care plans. Once you do create a custom resource list, you can organize that by client, by subject matter, by location. And as I said, it can really be a care plan to help those individuals that you're serving or that you're working with. So I'm going to go ahead and I'm going to add, because I don't have time to maybe go through each 9 of these these resources individually, I'm going to go ahead and I'm going to add all of them to a list. And I'll show you how to do that right now. If I click Add Page Results to List, it will add all of the results that I just generated to a single resource list. So I'm going to choose that, and I'm going to say Niantic CT Resources. Click Create List, and just like that, all 9 of my resources have been added to a list. Now I can go ahead and click on my 2-in-1 account in the upper right-hand corner, and I'll see that the first list is that brand new list that we just created together. You can go ahead and you can organize this list by alphabetically. So if you have a number of lists and maybe you're using individuals' names, obviously you don't want to include last names so that you're not divulging any information that you wouldn't want made public. But you could do it by subject matter, once again, by location, by organization. So you could do it by name, or you could do it by date created. So say that I've created this list with a client and I want them, we ran out of time today, but I want them to go ahead and go through that list on their own. We can go ahead and we can share that list. And that can be done either through email, through text message, or by copying the link and sending to them in another format. So either from your individual email or just allowing them to then go ahead and paste it in their browser. So if I copied that link and put it into my browser, just like that, it will pop up if I try to navigate through it again. If once my individual, had the time to go through that list, decided, I really don't need a food pantry, they can go ahead and they can remove resources from the list that aren't applicable to them anymore. And the great thing about using the My 2-in-1 account is that just like all of our resources in the 2-in-1 database, they're all continuously updated by a team of resource specialists. So our information services department maintains our database of more than 40,000 programs and services continuously. And per our accreditation from AIRS, the Alliance for Information and Referral Services, each resource within our database must be updated at least once per calendar year. And that's where we really do rely heavily on our professionals like you to help make us aware of any changes to their programs, to their services, to their location. And so I'm going to quickly go ahead and show you what I think is the easiest way to make sure that your resources are up to date. So let's say that I worked for the Salvation Army. Once again, now I'm back at my home page, and I'm going to use our first option and type in an agency name right into the search bar and type in Salvation Army located in Middletown, Connecticut, and click search. So now we'll see that a number of resources, or programs I should say, offered by the Salvation Army in Middletown are generated in our search results. I can click on any one of these results that were generated. So right now I'm going to go ahead and click on Winter Coat Giveaway. And just like that, it will give us a much more detailed overview of this program that's been entered into our database. It'll give us a quick description, the location, the phone number, the fax, the hours of operation, the website if I want to click on that and learn more, and then a description of the agency. If we continue to scroll down, we'll see that by searching Salvation Army and clicking on one of the programs offered, we can also take a look at all of the different programs offered by that Salvation Army. So we can go ahead and check each individual resource. If I worked for the Salvation Army, and let's say that my winter coat giveaway program had already begun, we'll say it's in the middle of November, and for some reason we don't have staff that day on a Wednesday to operate the program, or because of a flood or because of a fire, because of some sort of weather emergency, we had to close on a Wednesday in November, even though on the website here we're publicly open. I'm going to show you another benefit of having a My 2-in-1 account. If you click on Update This Listing, you can submit what we call a community comment or a public note. And what this does is allows you to publish a comment that will be immediately apparent on our website. So if I click public comment, I can say, we will be closed tonight, 11/15, let's pretend that's the date in November, due to weather. I'm going to mark it as a test right now so that our Information Services Department doesn't think that this program is actually going to be closed. If I submit that note and go back to our resource card, you'll see that there was a user note submitted by me, Annie, because I'm logged into my 2-in-1 account. If I didn't have a 2-in-1 account, I would not be able to submit that public comment. Another way that you can use this update listing button is to submit updates or changes to the resources listed in the database. And this is a more formal agency update process. So by selecting Update this listing, you'll see that it brings you to a pre-populated form. It'll have the agency name and the program name, and then ask you to provide your name, your email, your phone number, and a description of the update that you're requesting. Once again, we're assuming that I'm an individual that works for the Salvation Army. I would provide this information. I would say, hey, we're not going to start the winter coat program until December this year. Please update the description on your website so that individuals in Connecticut know that we won't begin providing our free winter coats program on Wednesdays until December. Click submit, and then someone from our info department will always contact you or the individual that submits that information to make sure that it's accurate and that they verify it before making that public change to our website. I know I just talked a lot about the benefits of having a My211 account, so very quickly I want to show you how easy it is to create one. So if I didn't have a My211 account or I wasn't logged in, when I arrived at 211ct.org, our homepage, I'd see login or sign up. So I'm going to say that I don't have an account right now, and I'm going to click on sign up. So right here we'll give you, once again, a quick description of what a My211 account is, and then in order to sign up, all that we ask is you provide an email, create a password, and click sign up. And just like that, you can begin building and sharing custom resource lists. So now that we've kind of done a quick tour of our home page, and I've talked about some of the bells and whistles and enhanced search and filter features and some of the new navigators and tools that we have available, I'm going to focus a little bit on our professionals page. So this professional page, just as the title would allow you to assume, is really geared towards individuals like you. There's a number of links to additional resources, to databases, to specialized directories, to various products that we make available to professionals like yourselves. So I'm going to go ahead and give you kind of a quick overview of what some of those tools are. So the first is specialized directories. And if you click on that link, you can browse through and download some subject-specific directories that, once again, just like our database, are continuously maintained by our Information Services Department. So if you're looking for a reentry guide in Bridgeport or reentry services in the greater Hartford area, if you're working with a veteran or someone that's active duty, military, we have a resource that's dedicated just to programs and services that are serving those individuals. So that's our specialized directory tab. We also have a link right here that you can order 2-in-1 materials. So we make these materials free for individuals like yourselves. So you can click on here and you can browse through some of the various offerings we have. This is what our bookmark looks like. If we went back, we'd see that you could also preview our wallet card. A lot of these materials we have available in English and Spanish. And most of our brochures, so like our standard 2-in-1 brochure and our child care brochure, are bilingual or multilingual. So one side is Spanish and the other is English. So after I've kind of browsed through the various materials and previewed which ones I might like to order, if you click here to order materials, all we ask is that you populate the number of materials you'd like, enter your name and the address you'd like them shipped to, and we will go ahead and we'll ship you those materials absolutely free. This is our way of making sure that the individuals you serve have plenty of awareness and plenty of outreach materials that will allow them the information they need to contact 2-in-1 should they need to. So if I'm going to go back to our professionals page, the next tab I want to show you is our outreach and training tab. And it's very likely that because you guys are on this webinar today that you've already been to this page. Once again, I'm going to shamelessly plug our 2-in-1 fall webinar series. So this is where you can go to sign up for additional webinars this fall. But this is also a great place to check out maybe this winter or later on once we get back into summer weather for a list of upcoming webinars. You can also view or share some of our archived webinars. So some of the previous recordings we've done. So if you want to take a deeper dive into some of our community connections or clinical community connections, you can click here for a webinar that's very specific to our 2-in-1 online benefit screener navigator. You can click here. And most of these webinars are between 30 minutes and an hour. And they're publicly available on our YouTube channel, but you can link to them right here at our archived webinars tab. This is also where you go to request a training. So if you want an in-person presentation or you want to organize a webinar for the individuals that you work with, maybe they weren't able to log into any of the ones that are offered during the series, this is where you would go ahead and submit a request form for another webinar or training. This is also where you can look at some publications and reports. So we put out periodic, what we call 2-in-1 barometers that take a really deep dive into some of the data we collect based on how people search on our website and based on the resources that they request when they call our 2-in-1 contact specialist. So very soon, I want to say within the next week or so, there will be a 2019 transportation barometer. So if you're interested in exploring some of the trends in our transportation service requests and want to know about resources in your area, I'd advise you guys to click back here, probably, like I said, in a week, and you'll be able to see the most recent edition of our transportation barometer. This is also where you can go to sign up for our Data Glance and our Community Connection, and these are monthly newsletters that we produce. The Data Glance, this is, like I said, a monthly publication, and what it does is it highlights some recent additions to our 2-in-1 database. This has been super beneficial to our contact specialists that are continuously making referrals to our huge database of programs and services, like I said, about 40,000. So anytime that we make an addition, we make sure that our contact specialists see this document so they know about some new referrals they can make. But it can also be beneficial to you. We organize them by category, provide a quick description, but then also offer a direct link right into our database. So the Walk to Work Hartford Neighborhood program is a new program that we've entered in our database, and we're excited to have a publication that allows us to show that off. And our Community Connection is another monthly publication we put out, and this highlights some topical or timely events or programs that are offered across the state. So our recent September advertised the Connecticut Veteran Stand Down event. It reminded individuals about the text to 911 that's available in Connecticut. It provided a list of healthy food donation options, and then it also made individuals aware of National Voter Registration Day. So these publications, once again, come out monthly. If you don't receive them, it's really easy to sign up. All you have to do is click here, enter your email, and if you'd like, your first and last name, and click sign up. The only required field here is an email, and you'll automatically be added to that distribution list. Oops. So I'm going to jump back to our professionals page and show you a couple more tools before I dive into the final component of our webinar. So I know we quickly went over earlier how you can update your agency listings or your program listings on our database using the Update Listing button within our search results. But this is a quick flyer that was created that also maybe it's something you can share with your colleagues or have available in your office so that you remember as we get closer to your annual update, how you guys can reach out to our info team or how you can proactively update your resources and programs within our database. I'm sure many of you have received calls from our awesome team, and if we don't hear from you, we're always proactive about doing that to make sure that your information is current and up to date. So finally, we have just a few minutes left, but I want to make sure that I show you one more tool that has proven to be really important and really beneficial to some of the work that our professionals have done, and that is our 2-in-1 Count online data dashboard. You could link to that from our professionals page, or you can type in ct.2in1count.org, and if you do that, you will land right on our online data dashboard. So what this does is it shows, it displays, I should say, all of our 2-in-1 call data. So every day, we have about 40 full-time contact specialists that work across 3 shifts, and every day those individuals receive hundreds of calls from Connecticut residents. When you arrive at the home page of the data dashboard, all the data you see will automatically show calls, or I should say service requests we've received from the last 365 days. So this database, or dashboard I should say, is continuously updated and current, so it reflects data as recent as yesterday. In the upper right-hand corner, you'll see total calls and total requests. So each time someone makes a call to 2-in-1, it's logged as a single call or a single transaction. But that one call could result in multiple requests for service. So if I recently lost my job and I'm calling to look for resume building help, or because I'm looking for a job fair, that's a request for employment and income. So that's a single service request. But our contact specialists are trained to really do some poking and prodding and holistic assessment of an individual's need when they call 211. So that one call for employment help might result in me divulging that I'm having trouble putting food on my table, so that could be a referral to a couple food pantries, or that I'm having trouble getting around town because I can't afford my car anymore because I've lost my job, or because I lost my health insurance. So that one call because I lost my job could result in multiple requests for service. So I like to make that distinction before I dive into the data. You should know that all of the data on this dashboard reflects service requests. So we have on the left-hand side of the screen, you'll see all of our 13 top categories for service. And then if you follow that sort of line over to the right, it digs a little bit deeper into subcategories within each of our top categories. So for housing and shelter, it shows shelter, low-cost housing, home repair, maintenance, etc. If I clicked on food, that subcategory would repopulate to show subcategories within the food category. You can filter this data dashboard by zip code, by county, by congressional district, by state and Senate district, state house and Senate district, by school district, or by the region. So region is individual towns. You can also choose to display custom time frames. So maybe I only want to look at data from yesterday or from the last week, or maybe I want to see data from the past fiscal year. I'm working on a grant application that asks me to provide FY19 data, and so that's how you would go ahead and decide, what time frame you want. So I'm going to choose to look just at the month of September right now. If I click the arrow, all of the data on the dashboard will automatically repopulate to display just service requests that were made over the phone during the month of September. It's thinking about it, I promise. So once that populates, it'll, try it one more time. Let's try from, I'll do the month of August instead. It might like that better. So once that repopulates, you'll see that instead of showing the last 365 days, we've selected a custom date frame, or time frame, I should say, to display in our data dashboard. I don't know why it's having a hard time repopulating right now. It could be my internet's a little bit slow. So I'm going to go ahead and just kind of continue to go over what's available on this dashboard. You could also choose, like I said, to show just a certain location. So if I wanted to choose just the town of Bloomfield, I could click search. And now it would show, if it was working correctly, it would show just Bloomfield data for the month of August in 2019. If it did display the data that we're looking for, you could choose to print it as a detailed report or as a brief report. And you could also take a screenshot using these different options over on the left-hand side of the screen. So sorry that this is it's not loading correctly right now. I encourage you guys to go ahead and play around on this data dashboard yourself. You'll see there's also a map here, and in addition to displaying our service request data, it has some census data overlaid with it. And like I said, in addition to this webinar recording, you'll also receive a detailed PowerPoint that will go over the 211 Counts data dashboard and provide some instructions on how you might use it. But we found that it's been super helpful for grant writers, for elected officials when they're providing testimony on behalf or in opposition or in favor of a certain bill that might be at the Capitol. In addition to displaying just our service request data, you can click on these little people right here to display demographic data, and you can see the data as not only a percentage but a count. So it looks like now we're back in business and it's showing some of our data. So I just clicked on count to show that all the data as a count as opposed to a percentage. All the way over to the right-hand side is a really important category because it shows our unmet needs. So each time individuals dial 211 and speak to a contact specialist and make a request for service, our contact specialists document whether or not we were able to refer that individual to a program to meet their need. So anytime we're unable to do that, it's documented as an unmet need. So this can be a really important piece of data for individuals that are doing needs assessments or trying to analyze gaps in services in their area. So once again, check out our 211 Counts dashboard. And that about wraps up our Tools for Professionals webinar today. If you guys have any questions, once again, I invite you to go ahead and chat them in the Q&A box. We're just about out of time, so if I don't get a chance to answer your questions today, I'll be sure to follow up individually. All right, everybody. Well, thank you again. I appreciate you tuning in today. My name is Annie. I work in our Community Results Center here at United Way of Connecticut. And a quick reminder that our next webinar in our 2-on-1 CT Fall webinar series is on utility assistance resources, and that will be next Thursday, October 10th at 12:30. So thanks so much for tuning in, and enjoy the rest of your day.